your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. You have wrist pain or tingling in your fingers. You might have carpal tunnel, and we have the specialist here to help you. Physical therapy is also here to help you with pain and motion. And radiation oncology is here with a new treatment for skin cancer. All that and the Library Foundation is here. But my first guest to start us off is Dr. Jonathan Feddock, who is a radiation oncologist with Baptist Health. Welcome.
Hello, thank you for having me.
Well, tell me, radiation oncologist, tell us what that means and what you do.
Sure. I guess if you look at cancer care as a whole, there's three main treatment kind of groups that patients usually face. One of them is surgery, which is probably one of the first ones that comes to mind. There's chemotherapy, which is most of the time either oral or IV type treatments that treat the entire body. And the third one's actually radiation treatments. Now, radiation has been around for over 100 years. It originally started with little radiation seeds or radium sources that we would place on patients. But nowadays we use machines. We use machines that take radiation straight from the wall and use electricity to create sort of an image, just like an X-ray or a CT scanner. But we can use those images and we can use those types of treatments to be very focused and target tumors in a person's body. So in a way, it's sort of a replacement that can be done just like surgery, but if we do it carefully and we do it very accurately, oftentimes we can do safe treatments that have small amounts of side effects, or at least side effects that we can predict.
Now, you mentioned tumors and cancers, but give us some examples of all those things that you treat.
Right. So unfortunately, people can get cancers in just about any parts of their bodies now. So a lot of times when we talk about in this state, we have lung cancer, which is one of our most common types of cancers that we deal with. And effectively, if we find somebody with an early stage lung cancer, there's an equal treatment that they can go to have surgery or they can have a radiation treatment. And whereas we used to do radiation that might take 6 to 8 weeks, now we frequently do treatments that are very short. They're patient specific. They are meant to be kind of a good quality of life outcome, and usually we try to keep them down to 5 treatments or less.
Well, that's pretty good. Now, you mentioned lung and you do other things, one including skin, and you have a new machine. Tell us a little bit about that.
Yeah, so one of the things that's happened that's changed over the course of my career, and it seems to change every 5 years, is that we get new technology. Just like your cell phone changes, so does our radiation machines. Well, what we try to do is pick the right tool for the right job. So I have radiation machines that are meant to treat deep in the body. I have radiation machines that are meant to treat very shallow in the body. And then one of the things that comes up when you have skin cancers is how do we get a radiation treatment that's only going to treat the smallest fraction of the skin. So at Baptist Health, we have a new machine that's called the Xoft. Now, Xoft is spelled X-O-F-T. So if you're Googling it to learn up, it's a little bit of a misnomer. But this is a machine that's designed to do superficial treatments, and it's meant to treat very small cancers. So much the same ones that you might go to have surgery for, we can actually treat them with radiation in as few as 5 to 8 treatments. And where I really see this coming into play is all of us have had sun exposure. We've had probably more than we need to. I'm sure most people aren't using sunscreen the way that we're supposed to. You know, if we get some skin cancers on our back or our arms, those are often easy to remove surgically without a lot of cosmetic changes. But when we get them on our face, especially around our eyes, our nose, our cheeks, those, when we have surgery, sometimes can lead us into a very different cosmetic appearance after surgery. So that's where I think this machine really comes into play, in that I can deliver a easy outpatient treatment. It shouldn't have really any pain regarding it at all. Typically, it's about 5 to 8 treatments. They are almost always 5 minutes or less. It's more frequent trips than you might need to do if you were to have a surgery, but at the end of it, we can usually clear these cancers pretty quickly. You might have a little mini sunburn where we did the treatment that'll heal in a week or two, but cosmetically you're going to stay the same appearance that you did before the treatment began.
So a little bit about side effects of both either the skin treatment, or are there certain side effects about radiation in general we should be concerned about?
So if we're going to talk about side effects for radiation, we got to realize that side effects are 100% dependent on where we're directing the treatment. So if I'm treating somebody's brain, we're going to have side effects related to the brain, but we shouldn't have anything related to the bowels. And vice versa, if I'm treating the bowels, we're not going to have any trouble with swallowing or sense of taste. And I think a lot of people have experiencers or maybe friends or family members who have had radiation previously and have had a lot of side effects. first thing, nowadays, I think with our treatments, we have a lot less side effects than we did 5 years ago, and certainly more than we did 10 years ago. But when we treat with this new machine, the Zoft unit, we're only treating millimeters deep. And I can adjust the depth of it, but effectively, if someone comes in for treatment, we scan the tumor, we figure out how deep it is, and then I do a treatment that's basically only that depth. So the side effects when we do skin cancer treatments largely boil down to a skin reaction, which is going to be short lasting. It'll be there a week or two. We can probably use some skin creams to keep it under control. After that, it'll heal, very similar to if you had a sunburn that maybe you got from sunlight outside.
And for those of us who are ugly, it's a better cosmetic deal.
I don't know how to answer that one, but I can keep the same cosmesis of what you have now.
Right.
So, we don't require there to be certain flaps or surgical fixes. But then there's also the other part that there are a lot of skin cancers in this world that are maybe not appropriate for the Zoft treatment. So if someone has a melanoma, that's probably one better suited with doing surgical resection first and then figuring out what other treatments we have. But for the basal cell and the squamous cell cancers that are superficial and we catch them early, it's a great treatment to offer.
Well, we thank you for what you do. We thank you for the care you give, and it's great to hear about the new machine.
Thank you.
Thanks for coming in. We'll be right back.